Welcome back to the Virtual PT Institute. I'm PT Jason. I'm ready to help you start to manage your orthopedic problems and your pain problems so you can start to get yourself feeling better. If you remember last week we talked on back pain a little bit, talked about the importance of your upright posture, both from sitting and standing. And I want to stay on the topic of back pain a little bit because back pain can be hard to manage. There's just so many different resources that are pulling you in different directions, and there's different philosophies of how to treat these things. And so you can kind of get into this and be like, well, what do I do? What's the best route for me? And not only that, as far as all the information is out there, but also there's just a lot of different things that affect back pain too. You got social factors in that, you've got environmental factors, and emotional factors, and so all these things play into that back pain, and it can be difficult to figure out what's the best thing for me to do. And so when we start to break that down a little bit, when you look at all the different exercises and research and different thoughts and opinions on how to manage back pain, there is one big consensus thing, and that is exercise, right? Exercise is certainly a valid means of managing back pain. It's encouraged to help manage back pain. There's many major medical institutions and tons of research and tons of journals that advocate for this. But the question comes down to, well, which ones? There's all different kinds of exercises out there. What do I need to do? How many of those exercises should I do? How often should I do these exercises? What's the proper form? All of these different kinds of things. And so today I wanted to answer that a little bit for you and try to give you some guidance on how to break that down, how I teach that breakdown to my patients. Because you can have successful management of back pain. And it comes down to this, really. You can have successful management of back pain if you are able to classify your back pain into different categories. As long as you can start to classify things, you're going to have a better outcome. So really gone are the days of, a generic exercise handout from a physical therapist, or just like, hey, go do these things and you'll start to feel better. As research continues to advance our understanding of mechanical and movement-related problems, we're really learning that subsets of exercises, or like groupings of particular exercises that are all built on the same principle or same movement pattern, are much more effective at reducing pain and then ultimately restoring your function. So I kind of break these things down into three different categories. There's lots of different things out there, some categorized into four, but I think there's good evidence behind really looking at three different categories. So what are those different categories? Great question. The first one is hypomobility. All right. The second one, instability. And then the third one, a directional pain. All right. So the first one, we think about hypomobility, right? That's really just a fancy word for stiffness. You can develop back pain when you start to lose range of motion, when the spine is no longer moving in an efficient way or in a normal way. And that's typically seen in all different directions. You just can't move normally, right? And so you can develop pain because of that stiffness and because of the fact that you're not utilizing all of your range of motion in all directions. And if that's the case, right, then you want to do things that target that, not things that won't do that. And so if you fall into the hypomobility category, as I like to break it down, you're going to focus a lot more on stretching. Right? You're going to focus on stretching the spine in different directions. You might even focus on other muscle groups of stretching that attach on the hip. The hamstrings can become really tight. Those are the muscles on the back side of your leg. They attach to the hip, and if they get tight, they can kind of rotate the pelvis back a little bit, change the pressure through your spine. So that, again, that can be another stretch that's really important to keep in mind. But when you're thinking about stiffness, you're going to think stretching, right? The second one we talked about was instability, right? So you're really flexible, and you might think, oh, why would I have pain with that? Well, unstable joints can become painful because we need to be in a good position, right? Stiffness means we're not moving well. Then we have good position, that's where we need to be, but then we have laxity, we have super flexible joints, and that's not great either. And so you can develop pain because of that instability. And so you think about, as we talked about just with the stiffness category, you want to do stretching. We're not going to do stretching activities if you're having pain because of instability, right? That's where you're going to focus on those core exercises, right? Thinking about man, how can I, utilize the corset muscles in my low back and kind of through my midsection here to begin to stabilize the spine in a healthy way and then decrease your pain level. So you think about exercises maybe like bridging or maybe planks or things like that can be a great exercise that keeps your spine in a neutral position but forces these stabilizing muscles to begin to fire more and begin to work harder. The third one we mentioned was directional pain. And this is sometimes when you see that your spine becomes painful in a certain direction. So maybe bending is more painful, or maybe side bending is more painful, or maybe bending backwards is more painful. But when you notice that you're having back pain, and it seems to be like one direction making that worse, you might fall into this directional category. And again, that's going to be another subset of exercises to help you feel better and decrease that pain. And so with those, you're going to work into the movement essentially that helps reduce your pain, right? So you might be doing the opposite direction of where you feel the pain. So just for example, if I'm super painful bending backwards every time, maybe I need to bend forwards to relieve that. You see that in cases of like a true structural stenosis, which is a fancy word for just saying, hey, this happens especially with elderly patients, but I actually do have decreased space between my vertebrae bones causing problems. When you're up walking, standing, and weight bearing and bending backwards, that can typically be much more painful. So I need to bend forward and flex to relieve that pressure. But again, that's not always the case because other people might go a different direction. And so when you think about directional pain, it's really dependent on how you respond to movement. You also see directional pain a lot when you start to talk about sciatica, right? Patients that have that nerve pain running down the leg from a low back problem. You'll typically see that diagnosis, that sciatica pain as we call it, which is really just a catch-all term that describes the symptoms. But you'll see that fall often into the directional pain category because those things can heal, but a lot of times it takes a different direction to make that feeling better. All right, so we've got 3 key categories, real simple categories, right? Stiffness, instability, and then directional. And so we can have different pain symptoms within those categories, but the point of this video is to highlight the fact that if we're going to start to get ourselves feeling better, we need to think about that, right? And not just do a bunch of exercise. We need to think about the pain we're experiencing and start to think about the underlying reason. That is it because I've lost movement in all directions? Is it because I'm really flexible? Or is it because I'm experiencing pain in one direction? All right. Now, there's a way to determine that because you got to be able to figure that out by asking good questions and by doing some self-examination. And so if you really want to learn how to determine what category you might fall into and then the subgrouping of exercises that are beneficial to you, I'd really encourage you to check out my back pain course. It's called Take Back Your Back. And I will teach you all the principles of these self-assessment and teach you the foundational exercises within each of those categories so that ultimately you can begin to get back to doing what you love to do. Hope you found this video helpful and kind of gives you something to think about as you deal with your back pain, to think, okay, what category might I fall in? Because again, as we talked about, much more success if you're able to categorize your back pain, because then you can work on tailored exercises to address that problem. All right, thanks again for stopping by the Virtual PT Institute. We'll see you next time.